I am Dylan Ratigan, and the big story this afternoon, premium support. It could soon be the new Medicare if the latest overhaul plan comes into law. It is a bipartisan proposal penned by Democratic Senator Ron Wyden, along with House Budget Committee Chair, Republican Paul Ryan. You remember his other attempt to reform Medicare earlier this year. It was really ripped apart by the Dems, deemed as the death of Medicare as we know it. But this is a new attempt, and in it, seniors would have the option to pick traditional Medicare or use a, quote, premium support government voucher in which they would be able to buy private insurance through a national exchange. Remember, we don't even have a national exchange because we have a monopoly. So the creation of a national exchange alone, at least one of consequence, in and of itself could effectively be a neutralization anyway of Medicare as a campaign talking point in 2012 and quiet some of the political pro-wrestling long enough to actually achieve some meaningful reform like a national health exchange for all of us, or at least some of us. No wonder the possibility of such things is being dismissed by the White House as radical. With us now for a DR Show exclusive, the plan's co-sponsor and an old teacher and inspiration on this subject, Senator Ron Wyden. Senator, it's a pleasure to see you.
Thank you, Dylan.
We've had lengthy conversations going back years about the idea of matching patients with doctors in a national exchange, as they do in, with your staff there and everybody else in the Congress. It appears you have a victory here, at least in trying to expand that available pool. Is that correct?
There's an opportunity here, Dylan. I think everybody understands you cannot get on top of this health care challenge unless you tackle Medicare. It is a huge issue, and we need to approach it in a different way, one that brings people together constructively. Here's an opportunity to put side by side traditional Medicare with its marketplace clout, and it's been very popular with progressive folks, and then say it should go up head to head with those who favor choice and competition. And I think the two hold each other accountable.
What is the greatest barrier? Let me put it this way. There have been clear barriers to your efforts to do this. One of them is the stranglehold of the private insurance monopoly, which doesn't want to deal with the competition. Another is organized labor, which has a benefit of very strong negotiating capacity to get health benefits in an employer-based health system. And a national exchange for health care is pretty much bad for both of those special interests. And they're both very influential where you work. How do you believe you can navigate against them?
You have just described, Dylan, what I call the status quo caucus. There are a wide array of special interest groups that benefit from doing business as usual. That's simply indefensible. You look, for example, just at the failure of the super committee. As a result of the failure of the super committee, there are going to be additional reductions in Medicare spending. So we've got to say this can't be put off any longer. I think this is an opportunity to make some basic kinds of changes. And when I look at this program, there are some obvious kinds of opportunities. For example, Congressman Ryan has agreed to support something I feel very strongly about, and that is to cap the catastrophic expenses that senior citizens face under Medicare. That's not there today. That's an improvement in the program.
Matt Miller, who's a panelist and a guest host on this show, wrote of your proposal the following. He said, referring to the Wyden-Ryan proposal, "This is the most fascinating policy and political maneuver of the year." I don't know what that says about our year. That may be an indictment of the year on some level, but it certainly is a compliment, however you want to interpret it. Was there an aspect of this where you're attempting to show constructive behavior between people in Washington? I mean, this just feels like there's more to this than just the health care legislation.
Well, Matt was being very generous, of course, and I think, again, there's an opportunity to tackle major kinds of issues, and particularly in the healthcare arena. For example, we ought to smooth the transition to Medicare, and one way to do that is to expand choice for employers and employees. So what Congressman Ryan has agreed to do, and it would be for literally millions of workers, is bring back something I felt strongly about, and that's free choice vouchers. Let's give employers who want to the opportunity to give their employees funds for their health care. It would be tax-free for the worker, a tax write-off for the employer. Give that worker and employers more choices, and give the worker the opportunity to go to these exchanges and get a better deal on their health.
Why do you think the White House is calling it radical?
Well, I am not certain that all the folks up there have read it. And for example, one of the things I was struck by is Congressman Ryan and I have agreed to have a more generous rate of growth for seniors under Medicare than the terms that the president offered during the deficit reduction negotiations with Speaker Boehner. So my hope is that as folks over there get a chance to look at the specifics, we'll begin the opportunity to really see people work together and not just to criticize.
Yeah, and as you may or may not know, but I have a book coming out next month called Greedy Bastards.
Let's make sure it's at Powell's in Portland, and there's another store up in New York. You know, I follow. Indeed.
I'm going to try and cut a distribution deal with you. But one of the points that I make, one of the tools that greedy bastards use is their influence over government to avoid competition. It is a great way to make money. It's a great use of money to pay a politician to help you preserve a monopoly. We watched McCarran-Ferguson, I believe it was, during the last debate come up and get shot down. Right now, the health insurance lobby spent, I guess, last year $376.5 million. The point is what you represent in these sort of real basic American values of, hey, what would happen if we allowed people to compete and choose, which is crazy, apparently, that's a real threat to the profitability of the health industry. Do you feel like you have any more push in your effort now than you did 3 years ago when you tried this?
I do, and I think particularly people are looking at approaches like that offered to members of Congress in the Federal Employee Health Benefit Plan. If an insurance company, in effect, mouses around a member of Congress, delays on paying a bill, doesn't follow through on what they're contractually obligated to do, the member of Congress can fire their insurance company. They can do what actually goes on in the marketplace. They can say, this isn't satisfactory, I'm firing you, and go make another choice. If it's good enough for members of Congress, it ought to be good enough for the rest of us, and that's the kind of approach that I think ought to be available to seniors. If seniors want to keep traditional Medicare, I'm going to fight with all my strength to make sure they can. If they want to choose one of these other alternatives, they ought to have that choice as well.
Senator, from your mouth to the laws of the land, we shall see. Thank you.
Good holiday.
You as well. Ron Wyden, ladies and gentlemen.